This afternoon, the St. Louis Cardinals canceled today's workout at Busch Stadium after they say they were unable to get results from the latest round of COVID-19 testing. Now, also today, the mayor of St. Louis, Mayor Letta Crewson, said they are seeing big backups at the labs conducting the testing and that they're really concerned about it. So this afternoon, we want to get expert opinion from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Garza is also Chief Medical Officer for SSM Health, joins us live. And Dr. Garza, we're going to jump right into this. What kind of delay, give us an idea, in testing are we seeing here in our area?
Yeah, so typically you see turnaround times, those we call them turnaround times, of anywhere from 1 to 2 days going to these national labs. So they're talking about these big national labs. But these delays have now been pushed that time out to anywhere from a week to 10 days. And the reason for that is, as everybody knows, the increasing number of cases around the country, they rely on these big national labs to do quite a bit of testing. And so you have more specimens showing up to the lab, and it's all a capacity problem. They just don't have the machines and the people to run all these tests in a very rapid fashion. And so that causes this backlog.
So right now, if I went out and got tested, say later today or tomorrow, would it be a couple of weeks for me to get my results back? Is there anywhere we could go to get the results sooner?
So it depends on where you go and which lab it's sent to. So as I said, there's two major labs in the United States, and that's where some of that backlog is occurring. The testing that we do in the hospital for patients that we admit to the hospital, we do with our own labs within our healthcare systems. And so we can turn those around fairly rapidly within 24 hours. So it really depends on, if you're getting admitted to the hospital, where you're getting the test done, where the test is getting sent to. And there are other smaller labs that people utilize as well. And they may have kept up with demand. I just don't know as much about those smaller labs.
Well, let's talk about after a long holiday weekend. We're seeing a lot of pictures of large gatherings, a lot of people not wearing masks. For example, we saw it again at the Lake of the Ozarks like we did over Memorial Day weekend. How concerned are you that we will see a spike in cases in the next couple of weeks, and how concerned are you that we'll see a big setback in the progress we've made?
Well, we're always concerned when we see people not following the guidelines, such as wearing face masks or socially distancing, things like that. That always increases the probability that transmission can occur. And so just like over Memorial Day weekend, we'll keep an eye on the statistics. So we'll keep an eye on who's testing positive and our admission numbers. We know that there's increased transmission going on in the community right now, and so that makes it even more worrisome because we know it's out there and it is spreading.
Well, let's talk about those hospital admission numbers this afternoon. Just about a half hour or so ago, you released the numbers. The 7-day daily average right now is 21. That's the highest number that we've seen in about 5 weeks. Does this raise a red flag for you?
Well, as I've said before, we always pay attention to that trend line and not to those individual numbers. We know that our admissions were down over the last couple of days, but that trend continued to go up, as you mentioned, at 21. And so it's still manageable. However, the trend line is what concerns us. It's concerning if it's going to keep going up. We don't know sort of what's sitting out there in the community as far as the number of cases is concerned and how many of those are going to result in hospitalizations, how much strain is it going to put on our capacity, making sure we can take care of other sick people, all of those things.
And one last question before we let you go this afternoon. More and more parents are letting their kids go to the friends' homes for indoor play dates, sometimes right now too hot to be outside. Most of them not wearing masks and obviously not social distancing if you're playing with your friend. Does it matter with children under the age of 18?
Well, that's sort of a tricky question to answer. So, of course, it all matters. But people that are younger typically don't have as severe symptoms with COVID-19 as people that are older have health problems. But it still does matter because there can still be transmission. And so younger people also can be more asymptomatic as well. And so they can spread it to other people and just not know about it. So it's sort of this, it's a couple ways to look at it. No, it's less risky for them personally, but it can still transmit virus.
All right, Dr. Garza, as always, we appreciate your time this afternoon. Thank you so much.
Sure.